You explained me that how important it is to do the root cause analysis. Diet is so important. You told me not to have anything that I like, including my paratha and the things that I really love. But I follow diet because my coach is very, very strict. The other thing that we talked about is like importance of sleep, going back to the nature.
Yeah.
And we started with like women health is more than just thinking about the fertility baby and everything. But still, I'll tell you, like, the only interest of my marriage for me was like, okay, I want to be like, I always wanted to be a mother. My daughter is 14 and that was one of the best things that I have done. Yeah. And women, those who think that I cannot do this, something like that, if they talk, like my friends or people, all my, people in my network, girls in my network, I tell them, hey, if you can be a mother, you can be anybody. Yeah. Because that's the toughest thing that you can actually do in life. But if you have done this, tab to tu kuch bhi kar legi aise. What about the fertility? If it is autoimmunity, how it is impacting the fertility?
Yeah. It's a very common scenario. A woman comes to us and she's like, I want to conceive. Okay, fine. You want to conceive. What's the difficulty you're having? I have been trying for a year, but I have not been able to conceive. Okay. Why? Let's see. Okay, we start with the history. And then you see, she has hypothyroidism. She has an autoimmune condition. Poor gut health, everything is there, right? All those are not spoken about. The concern here is just, I want
not
to
able
conceive.
To conceive, correct.
Right? So that's where then we have to turn around the priorities. Okay. You want to plan a pregnancy, which is great, but is your body ready for it?
Correct.
Right? If the body is not ready, it's the body's wisdom that it will not allow the pregnancy to happen. You will have miscarriages, right? Because the body does not want to house a baby, a new life, and it's not ready for it, right?
Body is very smart.
Yeah, it's very smart.
Body is very smart.
Somehow, if you still manage kind of, to carry on the pregnancy, we see the babies are not healthy.
Correct.
Why are there so many cases of autism today?
Correct.
Why there are so many cases of juvenile autoimmune conditions, right? So many allergies in children, eczema, etc. You look at the history, right? Many times it's the mother's health was not good, right? Or these are a result of IVFs. So you see what all happens during this process, right? The entire focus was on just somehow get the pregnancy to happen. There was no preparation for the body.
Correct.
So all that will of course result in undesired outcomes. So when we have a woman coming to us who wants to get pregnant, so we set the right priorities. We explain that, it's important that you first prepare your body for a pregnancy. It will happen naturally, given your body is prepared for it. So there have been few cases where one of them, 44-year-old woman, multiple allergies. She was hardly able to eat anything, because her immune system was reacting so much. Very poor gut health, a case of Hashimoto with rheumatoid arthritis, and of course multiple allergies. She was 44 and she had multiple failed IVFs. We had to set her expectation right that pregnancy would be the last thing that we will we want you to focus on. Let's work on all the other things. And she agreed for that. 6 months, her gut health issues resolved to a great extent. Her inflammatory markers came down. Her antibodies improved a lot. And after 6 months, she conceived naturally. So, multiple cycles of IVF, and she had almost given up hope that she can ever conceive because her health was so bad, right? So the moment we removed that from her priority list and included everything else that was so important and she did not realize, right? Things worked for her. Otherwise, it was always stressful that I'm not able to conceive,
correct,
right? And that's not the situation you want to give your body, because when you're constantly stressed about something, your sympathetic system is on, which is just prepared for flight and fight, right? Your entire reproductive system will be off, your metabolic system will be off, your gut health will be not funcking the way it should be doing because the body's focus is something else.
Correct.
And the moment you change that,
this is so important that you're talking, as I have friends, those who have struggled to conceive, and I've seen their life, they think nothing else, nothing else, no vacation, no sleep, no reading, hobbies, nothing. Their complete focus is, I'm not able to conceive. That's it. and it's not like, and it's a long journey, right? Like
Yes.
sometimes like a 5 years, 6 years, 10 years, they are into that journey. And I've seen that what you're talking is so important. I don't think anybody is talking about it. So you are saying that if it is a case of infertility, if you are
Yes.
struggling to conceive,
Yeah.
continue with whatever the conventional treatment that you want to do with IVF and other things, but find out what's the problem, right?
Absolutely. Even if you want to go with IVF, right, at least support your body.
Correct.
Right?
Correct.
Look beyond the hormones. If you're not able to conceive, you cannot just keep checking your hormones.
Correct.
Have you looked at the nutrition levels? Have you looked beyond B12? Have you looked beyond your iron levels? Have you looked at the toxins? Have you looked at your mitochondrial health, which is so important?
Correct.
And again, here for anybody trying to conceive, your partner's health is equally important.
Yeah.